Welcome back to Psych for Everyone. I'm Dr. Hani Nazha, and today we're diving deep into autism spectrum disorder, its diagnostic criteria, risk factors, and even some experimental treatments you may have heard about. Stick around because by the end, you will have a clear, structured understanding of this complex topic. We will also talk about some big things in the media lately about medicines and factors that could increase risk for autism. We will make sure we talk about all the current data and what we need to know about that. So, autism spectrum disorder, or ASD, is a neurodevelopmental condition that affects how people communicate, interact, and behave. The DSM 5TR, which is the Diagnostic Manual in Psychiatry, defines autism through two main domains. One, persistent deficit in social communication and interaction across context, and the second one is restricted and repetitive behaviors, interests, or activities. Let's break that down. To meet criteria, patients must show all three social deficits: trouble with social reciprocity, things like back and forth conversation or sharing emotions. The second one, problems with nonverbal communication, such as poor eye contact, limited gestures, or flat facial expressions. The third one, challenges with relationships, like difficulty making friends or engaging in imaginative play. In addition, they need at least two repetitive features or symptoms. Some of these symptoms are stereotype behavior, like echolalia, which is repeating what others are saying, or hand flapping. Insistence on sameness and rigid routines. They do not like any changes. They like to repeat the behavior over and over again. Highly fixated or unusual interests. Unusual sensory responses, such as being very sensitive to sounds, texture, or lights. Symptoms must start early in development, often noticed in toddlerhood, even if the official diagnosis comes later around age 6. Symptoms comes very early, but diagnosis may be delayed. The bottom line, autism is marked by three things: impaired socialization, impaired communication, and repetitive or restrictive behaviors. It can occur with or without intellectual or language impairment, and the severity is scaled from level 1 to level 3 depending on how much support the person needs. According to CDC's 2023 data, about 1 in 36 children are identified with autistic spectrum disorder in the United States. That's close to 3%. Globally, rates average around 1 to 2%. Boys are affected more often than girls, with a ratio of about 4 to 1. Risk factors fall into three buckets: genetic, prenatal, and environmental. In the genetic category, twin studies suggest up to 80% heritability. Dozens of genes are implicated, from SHANK3 and neuroligands to chromatin regulators like CHD8. Syndromes like Fragile X and Rett also feature autism as a core phenotype. The second bucket is environmental and perinatal, like advanced maternal age, maternal conditions like diabetes or hypertension, and prenatal infections like rubella, CMV, or influenza all increase risk. And here, vaccination against those illnesses could actually help reduce the risk of autism, not increasing it. We have certain medications that most clearly increase risk for autistic spectrum disorder and other neurological disorders in offspring. The major one is Depakote or valproic acid. That's why we recommend not to use valproic acid or Depakote in women in childbearing age. And if we have to use it, we need to talk about the contraception to reduce the risk for that. Anyway, the CDC recommend the use of prenatal vitamins for all women in childbearing age taking valproic acid and other psychotropics. Acetaminophen or Tylenol. So this is the hottest topic in autism these days. And let's make it clear from a scientific standpoint. We have some large cohort studies and meta-analysis that showed a possible association with prolonged use during pregnancy. Some of these studies showed there were increased risk by 1 to 2 folds. Some others showed increased risk by 3 folds. Now, all these studies talked about the prolonged use of acetaminophen. One of these studies actually went inside the cord and took the concentration of acetaminophen, and it was pretty high. So it's not only 1 time or 2 times use, because we know if the pregnant woman gets fever, for example, what would she take to break the fever down? It has to be acetaminophen. If she's having any pain and she needs to take some analgesic, which one is safer? Of course, it's acetaminophen. The theory is that acetaminophen depletes glutathione, which is an antioxidant that will increase oxidative stress in the developing brain. But, and this is key, evidence is still inconclusive. Acetaminophen is still considered safe in pregnancy when used appropriately. Always remember, there's no other better alternatives to acetaminophen during pregnancy. If the pregnant woman get fevers, the safest option is acetaminophen, much better than non-steroidal anti-inflammatory drugs like ibuprofen. For pain or analgesic, again, it is much safer than opioid. Currently, there's no FDA approved medications exist for core symptoms of autism. And here I want to say, when we say core symptoms, these are the main symptoms of autism, because we do have 2 medication approved for irritability and behavioral disturbances with autism, and these are risperidone and aripiprazole, but none of them is approved for the core symptoms. Now, treatments now focus mainly on behavioral therapy, education, and support. But we have lots of research exploring new frontiers. On the pharmacological frontier, medicine like intranasal oxytocin has been studied with some good results, but debatable still. And oxytocin is a hormone that is secreted by the posterior pituitary, and this happens during labor, but in the same time, it's implicated in the bond between the mother and her child. So, really, this is the theory behind that, that it may help social interaction and social behavior. We have other medicine like arbaclofen, bumetanide, and antioxidants like N-acetylcysteine or NAC. All of them have been tested with modest results. Another medicine called folinic acid or leucovorin that may help some subgroups, especially patients who have a problem with the conversion of folic acid to tetrahydrofolate. And some other future frontiers to treat autism, we have fecal microbiota transplant or probiotics are being studied. Still, results are early and we don't have anything convincing. The other one that I want to concentrate a little bit about today is the neuromodulation, which a very important concept. When we say neuromodulation, that means we are modulating the brain. We are trying to create new neurons and new connections or fibers. And we do that now with something called transmagnetic stimulation. This one is a machine that will give repetitive magnetic waves that will be converted to electrical field inside the brain. And this actually helps some of the brain cells to grow and create other cells and other fibers, which I think that's the future for that. Now we use it for major depression disorder, obsessive compulsive disorder, and smoking cessation. But we have lots of trend in the use of transmagnetic stimulation in treatment of autism. The last one that is on in the horizon is stem cell, still very experimental with safety and ethical concerns. So here's what you need to remember. Autism is defined by social deficits and restricted behavior starting in early childhood. It is highly heritable but influenced by perinatal and environmental factors. We cannot really tell you if any of these factors would absolutely cause autism or not. This is still lacking, especially medications. Nobody can tell you whether medication would cause autism for sure, but what we know that they may increase risk for autism, especially with the continuous use. So please try to avoid them. Scattered use of these medication may be okay, but make sure you follow up with your doctor and you ask for their opinion, because they know you better and they know the situation better, and they can make a better judgment and better informed consent. Experimental treatments are on the horizon, but the foundation remains early behavioral and education interventions. Thanks for watching Psych for Everyone. If you found this video helpful, hit the like button, subscribe for more Psychiatry Explained Simply, and drop your questions in the comments below. Until next time, stay curious and take care.
If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss future content.